Thank you for joining us to discuss current issues in long term care and what caregivers need to know. Our program addresses current hot topics in long term care and recent data that caregivers should know about concerning long term care facilities. We're going to share some important resources and also some important questions that caregivers should be asking of long term care facilities to help ease concerns. My name is Elliot Montgomery Sklar. I'm a professor of health science at Nova Southeastern University in Florida. I've worked as an educator, researcher, and leader of community based healthcare programs in the US and Canada for almost 20 years. I've worked to run and evaluate programs to support aging and caregiving throughout my career.
Thank you, Elliot. Hi, everybody. My name is Lucy Barylak, and I received my master's degree in social work at McGill University. I worked in the healthcare system for over 30 years, developing services for caregivers, working on research projects to identify caregivers' needs, as well as presenting the research finding nationally and internationally. Most important, I was a caregiver for my mother. Presently, I'm working at the McGill University in the Department of Social Work. Recent developments in U.S. long-term care facilities have raised significant concerns for patients and caregivers. Key issues include staffing shortages, potential Medicaid cuts, and challenges in assisted living quality as a result of these financial and human resource issues. Since the pandemic, and even ahead of that time, we have been tracking and staffing shortages across long term care facilities. Here are some current issues as of June 2025. So, we'll talk about staffing shortages and caregiver strain. The elder care sector is experiencing a slowdown in hiring, with employment in home health care, staffing, nursing, and assisted living decreasing from an average of 37,700 new jobs per month in 2024 to 28,200 in recent months. This decline is attributed to different policies. Immigrants make up a significant portion of elder care workforce. The slowdown in hiring is occurring at a time when the elderly population continues to grow, potentially leading to staffing shortages, higher care costs, and broader impacts on families and the overall economy. As of mid-2025, staffing ratios in U.S. long-term care facilities vary widely based on facilities type, location, and current regulations. Here's an overview of the current staffing standards and challenges. So, federal minimum staffing requirements are: in April 2024, the Center for Medicare and Medicaid Services finalized new minimum staffing standards for nursing homes receiving Medicare and Medicaid funding. These standards include total nurse staffing at least 3.448 hours of nursing care per resident per day. So this standard translates to different amounts of staff based upon the number of residents. However, only about 6% of nursing homes currently meet these requirements. Approximately 80% of facilities will need to hire more RNs to comply with especially the 24/7 RN requirement, including 92% of rural facilities. Nationally, the average staffing levels in nursing homes are insufficient, and here are some current national ratios of nursing care to residents. So, registered nurses, that is, RNs, about 1 RN for every 36 residents, nurses aide, about 1 aide for every 11 residents. When averaged out between the number of residents and of nursing staff, these averages fall short of the new federal requirements, highlighting the challenges facilities face in meeting staffing standards. There are also some state specific policies which you can look into based upon where you live. The implications of less staff means more care is needed from other resources, which includes from informal caregivers, really, and other family members. This can often cause caregiver strain, even if the recipient is in a long-term care facility. Many caregivers worry about the care that their care recipient receives, and this is a very real concern. The stresses that exist around long term care placement are real. Many caregivers think that once you place a care recipient, the stress goes away, but that is often untrue. If you think back to what caregivers experienced during the pandemic in being separated from care recipient in facilities, that trauma still haunts many caregivers even today. So, what do you need to ask facilities? What questions? And one of them should be, what is your current staff to resident ratio? How do you ensure adequate staffing during peak hours and on weekends?
There are also some potential Medicaid cuts and facility closures, which are significant. Many caregivers become surprised to learn, actually, that it is not Medicare that pays for long term care, but instead it is Medicaid who provides funding to cover long term care costs for eligible seniors based upon financial need. Very few seniors actually qualify for this, along with those with disabilities who are also eligible for Medicaid coverage. According to the AARP and other senior advocacy groups, proposed federal budget cuts could reduce Medicaid funding by $880 billion, which would certainly impact nursing homes and their residents. Medicaid currently funds 63% of nursing home residents and 20% of assisted living residents. Industry leaders warn that such significant funding reductions could lead to more facility closures, reduced services, and decreased staffing levels, exacerbating care quality issues. Over 770 nursing homes shut down between February 2020, during the month prior to the pandemic, and July 2024, displacing about 30,000 residents. With the senior population projected to rise significantly by even 2030, experts argue that Medicaid cuts are not well timed and counterproductive, potentially leading to increased hospitalizations if long term care beds are not in place, and also higher healthcare costs. Again, Medicaid still cutting the bill. So we need to be advocating for more funding to cover long term care and not less. As a country, as a society, we're not very well prepared for care needs as we age. We talk often about the importance of planning. So, some potential questions to ask facilities would be how potential Medicaid cuts could impact the quality and availability of care at the facility. Often you do need to put yourself on a wait list for a Medicaid eligible bed, so you may want to ask what the implications are on those wait lists and what contingency plans are in place to address potential funding restrictions or reductions. Now, these are not easy questions for many staff to be able to answer, but some facilities have already shown major acts of responsiveness by having fundraising events, hosting community events for a profit, even running talent shows, bake sales, bingo games. So you may want to see what you can do to help if you have a care recipient in a facility. Caregivers are coming together in very creative ways now to help support their care recipients, and it's a great way to connect with other caregivers in the community and through the facility in a creative way.
So let's look at assisted living quality and oversight. Assisted living facilities, which are often unregulated compared to the federal overseen nursing home, have been criticized for insufficient staffing, poor training, weak state regulation, and profit driven corporate ownership. This is not true, obviously, across the board. And we just spoke about cutbacks affecting nursing homes that are subject to federal oversight. It's important as you explore potential long term care facilities to visit. or if you have a care recipient in long-term care, to be very observant. Do staff know the names of the residents? That can be a sign of staff that have been there a while and that have relationships with residents, if that's what you want. How is the food? That is an important one for everyone, and it is linked to a better quality of life among residents. Make sure that a list of residents' rights is posted in a visible area with information about how to contact your local long-term care ombudsman to express any concerns or complaints. It is also helpful to know what care training standards are in your state. This varies and can be surprisingly low.
It's very true. As an example, in Florida, where I live, caregiver training requirements vary based upon the type of care provided and whether the caregiver is working for a home care agency or directly with a family. So, for example, certified nursing assistants or CNAs need to complete a state approved training program and pass a competency exam, while personal care aides, known as PCAs, may need a 40-hour training course. Home health aides, sometimes known as HHAs, work for CMS certified agencies and have specific training requirements, including 75 hours of initial training and 12 hours of continuing education annually. So it might be important for you also to ask facilities how they ensure that their staff are adequately trained and supported, and what measures are in place to ensure residents' dignity and quality of life. If you are looking to contact your local ombudsman and you don't see this list of rights, you can always call 211 in your local community or your local AAA.
Long-term care, and there definitely is financial strain. More recent issues that we've talked about today, like staffing issues, mean higher care costs, which have profound impact on caregivers and is an ever-evolving issue. If you think about supply and demand, if there is more need for long-term care staff and fewer available staff, then wages need to increase to attract and retain quality staff at any facility. Many younger generations are shouldering the burden of supporting aging parents, with government programs like Medicare and Medicaid providing limited coverage of essential services such as assisted living and home health care. Younger generations are they are after reducing working hours or leaving jobs to provide care. This not only impacts their current income, but also diminishes the future retirement and social security benefits, potentially creating a cycle of financially insecurity. Without systematic changes, the long-term care crisis threatens not just individual families, but overall economic stability. For baby boomers caring for other baby boomers or even their parents, the financial realities of caring for someone during a time of retirement or receiving a fixed income are significant, even forcing some to work well beyond retirement age and in conjunction with their own potential declining health due to aging and illness. There are many generational issues that impact long-term care, the need for long-term care, and funding for care as we age. It's important that we all consider these things. Some current long-term care issues are different for some caregivers than for others, and many also depends on where you live. Start planning early and doing your homework and your research. So let's look at some questions that you should be asking certain facilities. What support services are available for family caregivers, including respite and training? Are there financial assistance programs or sliding scale fees based on income? How have residence rates increased in recent years? How do you involve family caregivers in care planning and decision-making process?
Those are really good questions. And I also think that you brought up some really good points for people to think about I know a lot of younger adults are working independently for themselves, being more entrepreneurial, which is great, but that doesn't often come with retirement plans and long-term care options in that same regard. So it's important to think about these things early. I think we've brought up a lot of good, important, hot topic issues, certainly those that are being talked about in circles like the AARP and other national leaders who advocate for seniors and caregivers. So, in summary, really the landscape of long term care, as we know, is constantly changing as our care recipient needs. And caregivers need to keep up with what's going on. And most personally, what is happening with the care of a care recipient if they are in a long term care facility, or what questions you may want to think about if considering placement. So visit regularly and observe closely. This is true if you are looking to consider a facility. You might want to visit more than one time at different times of the day, different days of the week, as an example. If you do have a care recipient in a facility, look for signs of neglect, poor hygiene, unresponsiveness, or perhaps the opposite. They may be having a great experience, and then you want to be an advocate for that facility. So it's a good thing to know what's going on and to also share with a community of caregivers. You may want to ask for and review the facility's inspection reports. We have a publicly available website here, so all federally funded nursing homes are subject to inspections, which are made publicly available on the Care Compare website. And this is Medicare's Nursing Home Care Compare, along with different state agencies listed. It's an excellent, excellent resource. It even includes information about um, communicable diseases, infection rates, all kinds of things. So peruse through that certainly. And always advocate persistently, something we talk about a lot. Don't hesitate to ask tough questions or to voice concerns or file complaints if needed. Document everything in writing. Even if you have a verbal conversation, follow up in writing so that there is a paper trail. If it does come to a point where you need to involve an ombudsman or someone else, having that document paper trail is very, very important. And as we always say, join caregiver networks to share experiences and to get support. It's also a great way to find out more information about facilities in your area. So you may want to look for caregiver groups, for example, through your local AAA, or again, through calling 211 in your local community. Now, we promise to share a lot of resources with you. We have provided some what we think are good questions to ask of facilities, but we've also put together a long-term care checklist, and it's very long actually. It is on this slide and the next one, so we will go through it. But this really includes a very comprehensive checklist of things that you want to be looking for that go even beyond the things that we've talked about so far. So we've talked about staffing and care quality, for example, the staff to resident ratio. Also looking at whether or not RNs and aides are available 24/7. Some smaller, what are known as greenhouse type of care facilities that are popping up now. These are wonderful models, and they often have someone who stays overnight in the facility as well. So it really depends on the type of facility and to make sure that you're checking on the level of care. And also how often staff is trained, especially with regards to fall prevention, infection control, and what the staff turnover rate might be. So, some observations that you might have appear that staff look to be content, respectful. As Lucy said, they know the resident names, they're responsive. Another area is medical and personal care. It's important to know how medications are managed and reviewed, if there is an on-site physician or on-call physician if needed, and if a care plan is created for each resident's needs. So some things you might want to look for is that residents appear to be comfortable, well groomed, clean, that they have assistance available for toileting, eating, walking if necessary. Another area too is specialized services. So, for example, does the facility offer specific memory care or behavioral support? And are secure areas available for residents who are prone to wandering? That's an important one. You may also want to ask how aggressive behaviors or confusion might be handled. And again, all of this is based upon your care recipient's needs. So, some things to may look for that you may want to look for include dementia care certifications or a requirement for ongoing continuing education, as we discussed. Now, with regards to living environment, are the common areas clean, odor-free, welcoming? How often are rooms cleaned and laundry done? These are things that we don't often consider because care needs sometimes supersede the most basic things. Are bathrooms accessible and equipped with grab bars? And are meals tailored to dietary needs or certain cultural backgrounds, for example? Are snacks available? So these are all very important, certainly based upon the care recipient and what you know of the care recipient as well. Many facilities offer activities and have a vibrant social life available for residents if they're able to enjoy that. So you may want to ask about a daily schedule of activities, recreational or social activities. Are there spiritual services offered? That can be very important for some families. And can families participate in these events with their care recipients? So you may want to look at all of that. Ask to see a monthly calendar of events or photos or examples of past events. Now, costs are a very, very big one, and you may want to ask what is included in a monthly base rate, and if there are extra charges for additional services, like bathing, for example, or medication management. And what is the policy for rate increases? This can be very important for moving forward, as we know that inflation has been high and care costs keep going up. So get in writing a fee schedule and a resident contract and admission agreement to review. In terms of safety and oversight, you want to look at alarms, check-ins. As visitors, are you required to check in, for example? And how are incidents like medication errors, medical errors, or even falls communicated to family? Has the facility had any recent violations or citations? You would find that in the Medicare Care Compare tool, for example. And so that is an excellent inspection report and resource for caregivers. Now, family involvement and communication we know is so important, especially as it also links with caregiver strain. The more up to date you are on your care recipients' well being and their needs, the better that you will feel. So, how are families updated? Are there online portals or apps for updates, for health records? And how does the facility support family visits? Can you visit anytime, for example? Are you also able to meet with a care recipient's nurse or assigned staff team? So these are really a very exhaustive, comprehensive list of things for caregivers to think about as you're exploring facilities. If you have a loved one in care, we encourage you to think about these things. And of course, if you have further questions or want to reach out to the Wellman Charitable Foundation, you can contact them at 1-866-390-69 I'm sorry, 6491. Again, 1-866-390-6491. You can also visit the website caregiversos.org. And for additional videos, you can visit the WellMed Charitable Foundation's channel on YouTube. Thank you so much for watching this presentation today. We hope that the information is helpful.
Thank you, everybody.